We also see a lot of patients who reverse chain, as we call it, basically meaning they go to one provider, then the next, then they go back to the first provider. So there is a huge problem of patient understanding of this disease, and there is possibly also a problem of faith in the formal healthcare system. Yes, here it again, you know, a woman who gets to a stage where it's actually bursting, she's using holy water, and it's only when her son sees it that he says, you know, you have got to go to the health center, and then she finally got referred to Chico and Bessa Hospital. So a lot of time is wasted in these patient navigation projects. They move from institution to institution with similar levels of care, or they go back, and sometimes they have to wait a long time and spend a lot of money. Many more patient stories like that. So I think, you know, in conclusion, the lack of health resources, especially specialized physicians and nurses required for oncology, really complicate this journey for breast cancer patients. Patients don't understand breast cancer. They think it's something that can be treated with holy water. And so they present very late, and they have very little chance of survival once they actually present. They go often from location to location, wasting time and money of their families. And, you know, in general, it shows that there is a huge lack of awareness of breast cancer amongst people, general population of Ethiopia. We saw already that traditional healers are very important. It seems that patients who directly present to regional hospitals go more effectively through the system. But again, we see a lot of regressing through the system. So there is a profound need to improve the awareness of breast cancer, not just amongst the population, but also in the primary healthcare facilities. The general nurses and health workers who work in these facilities need to understand about breast cancer and need to be able to persuade these women to go straight to where they can get the right treatment without wasting a lot of time on other providers. And I think, you know, traditionally, we have ignored traditional healers, the non-formal healthcare providers in the societies we have ignored because they're not trained, they cannot be standardized, they're hard to control. But traditional healers, traditional birth attendants are the reality, the immediate reality of most patients in developing countries, and they are a resource. I mean, we worked with traditional birth attendants when we were doing HIV programs when I was with the World Health Organization. And they can be a valuable resource if they are trained properly and they understand what they're doing. So rather than ignore them and say to people, you know, you have to come to the formal healthcare system, I think we need to involve this resource in understanding better how they can help women and others with cancer. At the end, I just want to say we have published quite a lot on this project already. The one thing that's coming up in the pipeline, which I think is very interesting, not just for us, but for this forum as well, is to look at the impact of a project like this one, which was basically limited to one major referral institution, on policy in Ethiopia. Can you actually, by putting treatment in place, training people, creating awareness, raise the issue of breast cancer on the political agenda and make it part of the government's priorities? So that's one thing that we will be completing in the following 6 to 9 months, a study on that, which I think is relevant for all of us. So, thank you.